just, oh, okay. I'm going to just give you a little bit of history. CHAMP began 11 years ago. UNC Chapel Hill, Dr. Vicki Mercer, the physical therapy program there in Carolina, she had gotten a grant that was going to fund it. It began in McDowell County in Marion. Baxter's International funded the CHAMP, and we did it throughout the county, and it's always been students, so it's always been a free screening. And we ended up at the Senior Center and have been now, we're starting our 10th year at the McDowell Senior Center. So, and it's done now without funding. We have volunteers and students who are coming in, but it's a very meaningful, I hope that you'll learn. One of the things, you know, for me being a therapist and interacting with patients, having the understanding of how to interact appropriately with an older adult, not a senior, but an older adult, that's what the Geriatric Association says we're to call us. Anyway, so learning those skills are really important, and this helps you because, do you guys know about the silver tsunami? Okay, well, beginning about, I think it was maybe 5 or 6 years ago, every day, what is it, how many Americans turn 65 every day and will until the year 2030? Is it 500? I think it's 500,000. It's something along those lines. So when you look at that, if you're going into healthcare, the population you're going to be serving is people like me who are 65 and older. So it's important that you do understand and have a working understanding of how to do that. So that's one of the advantages of CHAMP. Community Health and Mobility Partnership. You will have your manual, and we can bring it up here, but I want to go through the policy so that you'll feel comfortable when you get there. I'm so excited. We are expanding to Buncombe County. We've had several other expansions. They've all been rural North Carolina. This will be an urban, but I think the need is significant, and we're excited about being at Grove, the Grove Senior Center, Senior Opportunity Center here in downtown Asheville. So it's important that you go through the orientation so you have a working understanding of what's going to be expected as a student. And how many of you guys have completed the Otega exercise program? Or, wow, what'd you guys think? Yeah, okay. It's a little overwhelming because, you know, you go, how do you put it into context just yet? And if you're not a physical therapist actually it was designed for physical therapists and nursing, and it was in home. And so, you know, not having that background may make it a little bit more challenging. I'm impressed that you completed it. Thank you for doing that. But if you've not done the Otega, then you should not be working with the gross motor skills, but it sounds like most of you guys have, and we'll try to go through some of those skills so you'll know about them. Each session of CHAMP, you will sign a confidentiality agreement. How many of you guys know about HIPAA? Okay, so basically this is the HIPAA. When can you share health information of a patient that you're treating? Does anybody know when that is? Well, it's basically based on a need to know. In other words, they have that person as somebody else who will be treating them or have a need to know, like you're referring them to another doctor or you're referring. So otherwise, the information should remain private, confidential. And so part of this whole thing with CHAMP, you need to make sure that any of the information, you may know some of these people, but it doesn't matter. You can't go back home and say, oh, Mom, I saw Mary Sue and she's not doing well. And now, if you want to talk to the participant and see if it's okay, if you share that with them, you might be able to do that. But it's confidential information. So you will sign your name on the confidentiality statement saying that you agree to uphold the confidentiality of all. And we don't call them patients because we're not seeing them yet as a patient. There's no reimbursement, there's no anything like that. So they're typically referred to as participants when they're in CHAMP, just FYI. So, and then all the participants, in order for us to administer any assessments or screens, we have to get a consent form from them. And that will be part of your jobs, is making sure that they sign the consent. Now, many of our participants may or may not be able to read it. It might be a vision issue, or they may not be able to read, or it could be that English is not their primary language. So you may have to read all this material to them, and that's fine. It's just a matter of, we may have to do that. The other thing is the privacy is all confidential. when we take a break, anything should be stored such that no one else could access it who is not a part of the CHAMP team. And so we got to honor that confidentiality with the material. So you wouldn't want to leave your file folder that has the patient's name and so forth on it and go out and have lunch and it's still sitting there. You got to make sure that it's taken care of whenever you go take your break. Any of you, do you guys know where the Grove Center is? The Grove Senior Opportunity Center is? Okay. It's right downtown. Parking is very limited. And so we'll talk a little bit more about that. Infection control, does it matter? Right now, is it not crazy? I mean, when you start thinking about, how many of you guys want the coronavirus? Okay, don't raise your hand. I know, I'm just teasing. But there's worse things. I mean, no, probably are, but right now it's probably the worst. But so far, North Carolina has a case or two, right? One. So we're not exempt, but there are other things too. Flu, and flu, I think it's on its downhill side, but it's not finished. So, and flu, when you're talking about older adults, can be deadly, just like the coronavirus. So infection control is essential whenever we're working with the participants who are coming into CHAMP. So hand washing, and you wash your hands at the beginning of the day, and I would recommend that you go to the bathroom, wash them, and have you been trained the 20 seconds singing happy birthday twice in order to get them washed so that you get them washed clean? And then anytime you see a new participant, you can get hand sanitizer. There should be hand sanitizer there and clean in between different participants that you're seeing. When you go to lunch, you may want to wash them before you have lunch, and then when you finish lunch and come back, you'll want to wash them. Anytime you leave and come back, you need to come in clean, so to speak, is the concept. So the last thing we want to do is share something that could be not good for our participants. And if you are ill, let's say on the 20th, you wake up, you got this headache that's killing you, you get chills, you check your temperature, it's above normal, and above normal now is so funny. They're saying that everybody's gone to subnormal fevers, some of the new research, so even a normal temperature may be a fever for some of us. It is for me anyway. But you check your temperature, you've got a fever. We don't want to see you. I don't want to see you. I mean, even the last thing you need to do is come join us on that day when you're sick and running a fever. Now, you have allergies, you have allergies, and you're not running a fever, but your nose is running. If you can control your nose running, it might be a different story, but you need to identify and know that it's not a contagious incident. And allergies would probably be the only thing that I can think of that might be in that ballpark. I don't know. So in that case, and you're scheduled to be there at the Grove Park or the Grove Center, then you need to let Dr. Maxwell know that you will not be able to call, text, whatever you guys have this set up, and let her know. And if you're sick the night before, Thursday night, you go to bed thinking, I don't know, then let her know. So the sooner you let her know, the better off we're going to be. But don't come. If you're running a fever, I don't want to see you. I will send you home, and I might not be pleasant. I mean, I say, I've had to do that. I don't like it. If a participant who's coming in is complaining with similar symptoms, especially if there's a fever on board, they need to be evaluated by one of the nursing, either instructors, EMT, somebody who can make a decision. And if not, then we would let them, they would probably be sent either, well, depending on what they need. If they need critical care immediately, they may be urgent care or go home or whatever. But we're not going to process them through CHAMP if they're running a fever. And so and they would be rescheduled for a next time that they would be there. I think we've got disposable pillowcases we have two, I think the pillowcases we have, we've changed some of this, and I know in Marion we have these pillowcases that you can just wipe off with sanitizer. They got a special covering and let them dry, and once you let them dry, they're sanitized. But we also have disposable pillowcases for the plinth or for the massage table that we'll be using for the orthostatic hypotension. You can wipe the table off also with sanitizer, let it dry, and then the next participant can come onto the table. I think we do have maybe some massage table covers that are disposable. But make sure that you're keeping those clean so that we're not sharing germs from one person to the next. And I think we're already booked up for the 20th. I think they've got at least 9, maybe 10 or 11 people we're going to see that day. It takes about an hour and a half to, well, maybe as short as an hour if they don't talk a lot, or depending on if everything goes really smooth, up to 2 hours. And a lot of times they love having somebody like you there that they can talk to, and they're going to talk. So anyway, just FYI. Plinth. Do you guys know what a plinth is? Okay.
My first thought was perhaps like that sort of cover that goes over like a examination table.
Actually, a lot of it's a terminology for an examination table, and we use it in physical therapy all the time. A plinth, like a treatment table, is it considered a plinth? So I don't know. We just try to throw you off anyway. Okay, let's see. Keep moving. Okay. I know by law, I have to, if I'm going to be there and as a physical therapist, I have to have a name tag with my credentials beside it. What I think is the case for CHAMP, we want you to have your name tag with, UNCA student. If you want to designate what current major you're in, that would be fine. But you do need, such that it would be large enough that you can see. We'll probably have disposable that you can write on and put your name on.
I'm printing them out for them. They say UNCA and they just say your first name.
Okay, great. Okay, but you have to have those on. You can't participate or help or volunteer without the name tag. And that's when you're transitioning to one of the participants and you're going to be assisting them, the first thing you want to do is to offer your hand if it's not contagious time and introduce who you are and verify who they are. So that's a very important skill to learn. Hi, I'm Martha Zimmerman, physical therapist. And if they want to shake your hand, fine. If not, right now, shaking hands is probably something you want to be a little avoid maybe, but at least let them know who you are, what your status is, and what you're going to be doing. I'm going to be helping you fill out your consent form. Please have a seat. So you want to make sure you give them clear instructions. Yeah, and you guys as new volunteers, it's not until you get there the third and fourth time that you start to go, oh, this is how, the first time is always a novel experience. You've never done it before, and so it's going to be new. So somebody who has more experience may determine that this patient is not an appropriate patient, or there may be some things that we may have to modify. You'll just need to follow the lead of Jenny Ryan will be there, who's another PT who's been helping for the past 3 years in McDowell. Lori Schroet has been helping. She helped with Western. So she has some working understanding of how CHAMP works. So they would be some of the other people who would be there who might step up and say, we need to do this. Then emergency procedures. You need to know the facility's emergency exits. This one, there's probably 2 exits. You can go in through the front door or the side door. I don't think there's any other options. And I don't know if they have we'll check when we get there the first time and make sure that we're comfortable with any, if we need to call the EMS. We've had to call the EMS because blood pressure was dropping out the bottom a couple of times on 2 or 3 different participants we've had. We've had a fall, but we caught them, and one landed in my lap, but nobody's gone to the floor. So if you're guarding appropriately, or if you're close enough to them, then hopefully we won't have any falls. But that's one thing could happen. Respiratory distress, chest pain, dizziness, unusual pain. Sudden onset of cognitive status change. They're confused. They don't know what's going on. And then sudden weakness. Those are all examples that we might need to do something about it. And you may need to get help from one of the nursing instructors or somebody else to help determine what's going on. Fire, when we get there. If there's a tornado warning, we probably either need to, we'd probably have to go to the center and close all the doors. I'm not sure exactly how they handle it. They got a lot of windows on one side, but not on the other. So these are the 2. Grove. The big issue with Grove Center, the Grove Senior Opportunity Center, parking is extremely limited. And so what I challenge you guys to do is carpool with all the people who are coming from UNCA in one car if you can. The other thing is we're very fortunate at McDowell. We do get lunch. They provide us lunch there with the seniors. They have what they call a congregate meal, and they will allow us to have that congregate meal with the seniors that are with the older adults. But you'll need to bring your meal on the day that you'll be there on the 20th if you're helping on the 20th. So something that you could pack in, a cooler that you could keep an ice pack with, so you don't have to worry about putting it in the refrigerator if it's something that needs to be cold, or peanut butter crackers, whichever, you know. Let's see. Yeah, bus. I mean, but you guys you're too far to walk. It's probably.
Yeah, and I think we'll work it out, but the bus does pick up right here and go straight to Cox Avenue, which is a block away. So
Oh, okay, okay,
we have that as backup.
okay. Yeah, this is important. You need to be ready and be there ready to participate 30 minutes prior to the time that we see our first client. And I think our first client is scheduled for 8:30. I think they will be open. I don't know that they normally are, but for CHAMP they may be open at 8 o'clock so that we could get tables and all the equipment placed appropriately and be prepared for all the participants who would be there. You need to stay. Now, I know some of you guys are splitting days. So if you're splitting days, you need to arrive 30 minutes before the other one's leaving, and then stay until the last participant's assessed, or check in. If there's something else going on, you need to let whoever your faculty person know what's going on. The nice thing about overlap is that you can share with the person who's coming in the afternoon, this is what has happened, this is what I've done, and just to let them know, so there'll be an exchange of information about how the morning went and what you're anticipating for. And that's really critical if you start looking. I mean, nurses do it all the time when they're in hospitals. That you got the shift over change, and there's an overlap so that they can share information. That would be kind of what we'd be doing there. And we can do a meeting either at the lunchtime or at the end of the day. And sometimes we can all sit down together at lunchtime and discuss, what's going well, what's not going well, what do we need to shift or do different. And this will be our first time at CHAMP here. It won't be perfect probably. We'll need to make some modifications, but we can process that as we go along, and we'll hopefully get it figured out. In terms of information, and I've already said this is a little bit redundant. If they can't read, if they can't see, or if they can't read the English language, you may need to read all the forms to them. And real important with that would be that you would go slow and speak loud enough for them to hear. And confirm that. So I'm going to start reading. Can you hear this? Is this okay? Because hearing impairment is significant as you age, just as visual impairment becomes the same case. So make sure that they're understanding. And you may want to, once you get to the end of a paragraph, now, did that make sense? Do I need to go over that again? And that's the reason things can take so long. And when you're filling out forms for them, handwriting, God, it's not my skill anymore. It's old woman hands. But making sure you write so that somebody else can read it is really important. So that's very important. And if you're going to have to leave, something comes up and you're going to have to leave, let your team leader know what's going on. They need to, and that would be Dr. Maxwell, let her know what's going on, or let me, so that we can plan for it and be ready to take care of all the participants who are going to be there. Now, I typically manage the CHAMP in Marion, and Jenny will be the coordinator here, or the team leader for the Buncombe County CHAMP. Now, these are the forms that we will be doing, and I think what we'll do is go through this instruction and then come back and maybe do a practice. And so I'm going to talk to you about them, and I can bring some of them up on the screen so you can see them too. But this is quite a bit of forms that you have to fill. They have to complete the consent, the participant information, which I think of it as the health history form. So it includes all their past medical history that you need to know. The assessment summary sheet, which is very detailed. You're recording all the assessments on one single sheet where you can find like all the things that you, like their cognition, their depression, their fear of falling, all those go on this one sheet. And that's what these next, well, medication list, and we're not sure yet whether we're going to have pharmacists there or not. But if we don't, we may need to review the medication, and they should have it written down, their dosage, and we'll look at that. We're going to look for interactions to see, and the Beers list, are you familiar with the Beers list? It was developed, I don't know, maybe 10 or 15, 20 years ago. Yeah, I can't remember. But anyway, it's looking specifically at inappropriate interactions of medications for older adults. And so it has a whole list of medications that would put an older adult at risk for harm. And we have a complete list, so we look at their current list and identify if there's any on that Beers list, then we note that. Any of you guys use any pharmaceutical tools like Pocket RX or Epocrates? Okay, those are two tools you can download. One's a free app. The Epocrates is a free app. The Pocket RX now they charge for, but you type in the name of the medication and you can look it up, and you put the list in and it will note any interactions. And we would be sending that back to their primary care so that they would know if there are, interactions.
And before any of y'all would be responsible for that, we would make sure that you feel comfortable.
Yeah,
Because that's something that,
it's not casual.
it's not casual, it's hard, it's overwhelming. So,
Mm-hmm.
But we're gonna try to have pharmacists who are doing their geriatrics fellowship be the ones to ultimately do the review so that we have a professional. So just,
The other thing is, have you ever heard the term polypharma? And that means basically, one of the high risk factors, if you're taking more than 4 prescribed drugs a day, then you're in that risk factor, and that's considered polypharma. So that's real important that you could write down the list of the drugs and when they take it and the dosage. And actually with the Epocrates, it's not that very difficult to put the list in and identify. The accuracy from what I'm hearing on the Epocrates, it may or may not be updated often, but it's an indicator. The other thing is that, okay, I'm a patient, I'm a participant. I go to my primary care doctor, I go to my arthritis doctor, I go to my orthopedic surgeon, I go to my neurologist, I go to my so I'm having medicines given to me from lots of different doctors. They may not all know everything you're taking, or your primary care may not know. And by getting a full list of all their medications, then we're able to send that back to the doctor and let them know that, or their primary care provider. Real important one. The next one is called the ABC. It's a confidence scale it looks at fear of falling. We'll look at that one in detail. The mini mental state, it's looking for cognition problems or dementia, early signs of cognition problems. Geriatric depression scale is looking at, and we're using the short form, thank goodness, it's only 15 questions, but depression, who would have thought, if you're depressed, you are at increased risk for falls significantly. And then the RAPA, it's a rapid activity participation activity assessment, I think is what it's called. It's not my favorite, but do you guys know about fragility? When older patients become fragile, they say they go into fragility, and they're increased risk for all kinds of health issues. So if they're participating in activities like exercise and moving, then that decreases their fragility and can help their outcomes and reduce their risk for a lot of things. So we look at that, and we'll look at them. As you assign, or we have a new participant, they will be given a number, and there will be a book there at the facility, and you'll put the number and their name, and we'll record that as we go through. So if they're returning, let's say you come back in July, and they're saying, oh no, they've not been here, check anyway. They may not remember, just to make sure. If they're saying, oh no, I'm new, go back and check, especially next year. You only want to assign them one number. so that we can keep records. Yeah, I think that's okay. Intake, some other additional information. Yeah, I've said this again. You may have to help the person. Three real important things on the intake information form. Make sure that you've got consent. If you don't have consent, then we can't proceed. You need their primary care provider's name. Now, they may not have the address, and we can get the fax number, but we're going to be faxing their primary care all the information, a summary sheet of all the information. So we've got to have that in order to be able to complete the assessment. And then number 19 question, which is on that information session, is do you limit your activities because you're afraid you might fall? That's one of the reasons that we would decide that we would possibly give them Otega exercises. So that would be in the decision-making tree. And then, let's see. Do you have a history of fall within the last year? Have you fallen within the last year? And that's one of the questions, so. Okay, let me keep moving so we can. The assessment summary sheet. Let me just go in, I'll go through this quick and then we'll come back and look at them. The assessment summary sheet, you're going to be recording all the information from all the different assessments on this one form. And I'll bring it up in a minute, let you look at it. But it's important that you get accurate and that you can read the data that you're putting on there. So we'll talk a little bit more about that. The ABC, that stands for Activity Specific Balanced Confidence Scale. I never can remember that. The mini mental, and that's one. We'll talk through that and let you see how you administer it. Do you know what confounding data is? Whenever you're doing research and you're taking information, if you lead the person into making an answer that was not their answer, maybe, that would confound the data. We don't want to do that with our participants. We want to make sure that they answer according to what they're, the way they need to answer it. So we'll talk about how to administer these different assessments so that you're not leading them into any direction, not confounding the data on that one. Let's see, geriatric. Okay, so there's 16 different scores on the ABC, the mini mental. We'll look at it. First page, geriatric. Yeah, we're going to look at all these individually. The rapid assessment of physical activity is the one, and there's two different sections. I'll show you how to do those pretty quick. But okay, this is the summary sheet that you'll be doing. And the participant's ID number goes at the top. There's not a name on this, so it's non-identifiable information for future. What year? So it would be 2020. You'd fill that out. You just ask them, how tall are you? And I'd tell you I'm 5'8", but I'm only 5'7 3/4. So, and that's osteoporosis. See, the ABC score, the confidence scale score would go there. The mini mental score, we'll look at and show you how to get that. The geriatric depression scale score would there, and we're using the short form instead of the long form. The RAPA 1 and RAPA 2, we can weigh them. We've got scales, and you can weigh them and see how much they weigh. You record theirs. And then this is the orthostatic hypotension. What's hypotension? Lower blood pressure. And why is it ortho? What are they talking about? Orthostatic. Do you know what that means?
Because it has to do with the change in movement.
Change in position, right, exactly, good. So when you're laying down, the blood typically can pool somewhat at your feet, and it's not up in your head as much as anyway, so when you take a rapid movement to a standing position, it may stay down there and not come up to your head. And if they're on blood pressure medicine, if they have some other conditions, it can, and that's a huge risk factor for falls, when getting up too quick. But so we're checking that. And what we're going to do, they'll lay down for a period of time. We'll let them rest, but we'll talk about that more. So 5 minutes supine, laying on their back, okay? And you'll take their, we have pulse oximeter so you can get their heart rate, pulse. And then initial standing. We were doing, there's several different ways to do this, but we're doing where they come from supine or on their back to immediately standing. And so you get their blood pressure when they're supine, get their pulse rate, and they should have been there 5 minutes. Now, this is going to be a tough one. you really, some of the new guidelines, when you're taking a blood pressure, somebody should be in that position for at least 5 minutes before, and you should not be talking to them, because talking can elevate their blood pressure. It can, and so you need to let them know, I'm going to let you lay here for 5 minutes or 3 to 5 minutes. And if you need me, let me know, but I'm not going to talk to you. And you can maybe walk away, or just so that you don't distract them or let them rest, okay? And then when you take the blood pressure after they've been laying down, then you have them come to standing, take their blood pressure immediately, and pulse. And then let them stand for 3 minutes and take their blood pressure again, okay? And we'll look at the standards on this, so, and the pulse ox. So that's the complete orthostatic hypotension assessment. Yeah. And the guidelines for not talking and letting them stay in the position for at least 3 minutes has only changed within the past 3 years. You don't see it happen a lot in the clinic, unfortunately, but we're trying to follow that. Okay, the handbook talks about accompanying the participant. Part of the activities, you're going to be doing the consent form, the information form, all those assessments, the mini-mental, the ABC, the geriatric depression, and the RAPA, sitting in one room, and then you're going to walk with them to another location. Accompany means that you should be within the distance of this to this. If they're beyond that, I can't catch them if they start to fall. And I know that one real well. When I went home between my first year and second year of physical therapy, my mother had gone, it was Christmas, and we were, they had put the Moravian star out in the eave of the porch where my mother lives. And she wanted to go out and see it, and she wasn't 80 yet. But anyway, walks out the house, and she had spinal stenosis. Anyway, she looks up, she gets dizzy, falls. She was this far from me. I couldn't catch her. She fell and broke her hip. Now, you can't catch them if they're not within this distance. So and that means you're going to be walking to one side. If they're using an assisted device, go to the opposite side if it's a single cane or something, or just go slightly to one side and behind them. If you don't feel like that you could catch because the participant is bigger than you, you need to make sure that you have a second person who could be on the opposite side, And you don't have to touch them. I mean, if they're really unstable as you see them coming in, we do have gait belts, and ask them, is it okay if I put a gait belt? So the last thing you want to do is jerk on somebody's arm, catch them underneath their arm. Why would you not want to do that? Can you think? Well, the weight of the body, when you stabilize the arm, the weight of the body can actually sublux or rip their shoulder out. And you don't want to do that. Controlling at the waist is going to be better because you're not going to do any harm. So making sure that you don't reach for the arm, you reach for the torso or the body, So that's a real important thing. And you've probably not been taught appropriate guarding, but that's something that we learn in physical therapy, So you got to be close enough, and you want to control them somewhere between here and here, not under the arm or through the arms or anything. And that's called guarding. Yeah, let's see. Yeah, and like I say, if the person's too big, or if they're unstable and you don't think, let's say they're real ataxic, they're all over anyway, they don't have good muscle control, have a second person with you. You want to be safe. Do no harm, remember, that's the important thing. Okay. This is a whole lot. Is your head spinning yet? Because I got Miami J collar. No, I'm just teasing, I don't have them. Do you guys know about them? You put them on, they keep your head straight. No, never mind. Okay. Okay. Yeah, this is I think I've already covered this. This is the procedures for the orthostatic hypotension, laying on their back, supine. Supine is on their back. I don't know if you know that terminology. You take, and they need to be at least 3 minutes, preferably 5. Get their blood pressure once they've been there and record it. And sometimes it's nice to work in pairs. Somebody's going to record and somebody's going to be putting on the blood pressure cuff and administering the blood pressure cuff and doing the pulse oximeter. And then have them stand up. You want to know if they become dizzy or weak or have anything, visual problems. So sweating, or they become white, chalky. And then measure immediately their blood pressure standing, record that. If you have any of these problems, like they start to sweat or they become white or they get dizzy, let them sit back down immediately, because the last thing we want to do is pick them up off the floor. Okay. And then if things are going well, then you take the blood pressure after they've been standing. And again, most important thing is that you're standing within the distance of from here to here, so that if they start to fall, that you would be able to catch them. And this information is on the assessment form that we were just looking at. So if you can't remember some of this detail, and that's what we're looking at here. Normal blood pressure, and these have changed in the past 3 years. So these are your systolic blood pressure and your diastolic blood pressure, normal, elevated, and hypertension, different stages of hypertension. And I can't remember it. I look it up every time. So, but those are important but it's on your sheet. You can look it up. Now, you guys have still got to pass your licensure exam, so you might want to memorize this. I don't know. And then this is the postural hypertension. If they have a decrease in systolic of 20 millimeters of mercury from sit to stand, and it lasts for the full 3 minutes, then it would be considered orthostatic, or either 10 millimeters of mercury in the diastolic, and while they're full. They don't consider it orthostatic hypotension if they resolve within the first 3 minutes. I don't understand that, but anyway, this is the guidelines that they have. So, but you would want to note that it did drop down and that it recovered in that time frame. Yeah, and you'll want to record the heart rate too, so increase more than 20. Yeah, you got some issues too, so. And this also is on the form. If you can't remember it, it's there. Check it whenever you record and see. Medication, this is a little bit more detailed than what we're talking about. High risk, we're looking for high risk medications, taking more than 4, and medications that might have interaction. And I'll show you the Hippocrates app, and you may want to put this on. It's, let's see, it's this app right here. I don't know if you can pass it around. But you enter the list of the different medications, and it comes up with any interactions that there are, and you can, then you write that on the sheet and record that. I'm hoping that the pharmacy students are going to be, or residents and fellows are going to be there, and you know, like we said, the beers list, I'm hoping to get just a simple beers list. Currently we have they updated the beers in 2019, and it was a whole article, and it's above my pay grade to be able to interpret that. Pharmaceuticals, who was going into chemistry? Yeah. Oh, bless you, my children. Yeah, so you can know what you're doing, but it's not, medications, it's a difficult one for me, but hopefully we can definitely get the list of all the different medications they're taking so that we can share that with the docs or their primary care providers. Okay, and then if there's a red flag, or if there any of the things on their health information makes you go, I don't know that this person should, we need to be cautious in getting up and moving with this person, or they're not stable medically, their heart rate's not good, anyway, you need to share that with the person that you're handing your participant off. Like you may be doing just the screens. And if they're going into the next phase, please let them know and tag it with a flashcard or sticker, red sticker, and communicate that. Okay. Yeah. Again, when they're moving from one station to the next station, somebody needs to be that distance from them, close enough that if they fall, we would keep them from falling. Yeah, and again, any concerns that you might have with the physical therapist or them being up and moving, let them know. Now, they should review it and all the information, it should be there, but just to share that with them. That's good interpersonal or interprofessional interactions. That's so important. Let's see what I've got. Okay, so these are, let me let me do this. And you've seen, some of you guys have probably looked at the manual. This is the assessment tool, and like we said, you've got the ABC score that you record, and it's got the cut score. If it's less than 67 or less, then they would have fear of falling. Do you guys know anything that you could do for somebody who is afraid that, why does it matter that somebody's afraid that they might fall?
It limits their activities.
They absolutely limit their activities. And what happens then?
And then they do less, so they exercise less effectively.
And so what happens then?
They get weaker and more prone to falls.
Exactly. And so it becomes this, downhill slide and it's inevitable, it seems like, and it shouldn't be. And you guys are very blessed in Buncombe County, A Matter of Balance, which is a fear of falling 8-week course, great course that we can refer them to. And it addresses it specifically. The whole class is designed by psychologists and by occupational therapists, home modifications. So that's real important that we identify that and we get them signed up for an appropriate class for that. Mini mental, when we're looking at, again, the lesson 24 on the cognitive, what's the issue with cognitive impairment? Can you think of some things? Let's say I'm early stage dementia, why would I maybe have increased risk for falls?
Decision making.
Yeah, boy. Yeah. And, I'm going to go ahead and run to that telephone. And should I? Probably no, because it's a scam call, but then I'm going to trip on my way there because the telephone's ringing. I got to go answer the telephone, And so those are all those, things that get out of place and get messed up. And there's all kinds of other things. That's just the beginning of when you talk about cognitive impairment. But there's strategies for that. And you guys have the Land of the Sky Council of Governments who have all kinds of fabulous programs that we can refer the people to. So that's important you understand that. Geriatric depression scale, why would depression matter? Can you think of reasons? It's kind of similar to the fear of falling. We limit our activities. We get depressed. Do we go anything? Well, and then how many medicines are we taking? And then are they psychotropics? So the medications become an issue and all the other things. And so it's downhill spiral often a lot of times with depression. We're lucky in McDowell County we have Healthy Ideas, which is a program for seniors that addresses depression. I don't think it's here, but there are other programs that we can find for them. Rapid activity, and we'll look at that one. That's, how much are you doing of activity a day? And if you want to maintain your muscle, do you guys know what sarcopenia is? Oh, okay, good. All right, do you know osteoporosis? Do you know what that is? Okay, somebody tell me what osteoporosis is.
So osteo being bone, porosis, just weakening.
Yeah, bone loss, yes. Weakening of the bones, some bone loss. Osteopenia. It's the early stages. It's before it gets to the point that they say it's a significant amount of bone loss. It's the beginning stages of osteoporosis. Or sarcomeres. Do you know what sarcomeres are?
So is sarcopenia like the beginning of muscle loss?
Yes, muscle wasting, exactly. And by the time we're 35, or maybe even earlier, we're already beginning into sarcopenia. Dadgummit. It makes me mad, but anyway, we can reverse it, and thank the Lord we can reverse it. So doing something about it, they call it exercise. And it's that bitter pill that you don't want to take, but it's important, So anyway, I'll get off my soapbox. But those are some activity, knowing your activity level, can be very important. And actually, what do you know about better than a pill for depression? Do you know about that? Do you know an intervention that would be better than a pill for depression? Exercise. So what do you do for diabetes? Exercise. Well, not always, but exercise can resolve a lot of, maybe obesity. Anyway, I'll get off my soapbox on that one too. Okay. We've talked about that. This is the sheet. Okay, wait a minute. Yeah, you're going to record Okay, medicines, the question becomes after you do the list, any medication changes or medical concerns, medication concerns. And so if they're taking 4 or more medicine, you would document that there. Vision, when was the last time they had an eye exam? Why does vision matter? Yeah, you need to be able to see where you're going. So if you can't see where you're going or where your feet are in space, you got problems, okay? And then concerns about vision, you know, I've already had my cataracts removed, thank the Lord, and it made a big difference. Driving at night was not fun, but then you got other issues too. So vision becomes a real issue for a lot of people. Balance, and this is the one that, you know, we'll look at too. We'll be looking at 4-stage balance, and that's feet together, standing there for 10 seconds without holding on to anything. Semi-tandem, feet that are, so they're like that, and there's a form, we'll go through the form. And then full tandem, and 10 seconds in this position. And then single leg stance, they need to do 6.5 seconds in order for it to cut score that they're still okay. But we're looking for them to be able to do it for about 30 seconds. And there's some research that says that if you can hold a single leg stance on both legs for a full minute, it can begin to reduce osteoporosis. So I don't know that, you know, anyway, just FYI. Grip strength, do you know what a dynamometer is? It measures their grip. You'll have them hold, they'll be sitting in their chair, hold their arm at a 90-degree angle, arm up against the bottom, or the body, squeeze as hard as they can. And you don't want them to hold their breath. Why not? It can cause a problem with their blood pressure. You don't want, and so, okay. So you want them to blow out. And you do 3 scores on either side, and you average the 3 scores. And we'll show you the dynamometer. It gives you, and they're normed. It can begin to identify if somebody is frail or not also, if they're below the norms. Okay, grip strength. 30-second sit to stand. You got a chair up against the wall, it has arms on it. Does it? Yeah, good, okay. And hands across their body. This should be all the way up against the wall. And you're gonna say, ready, go, and they're gonna stand up and sit down as many times as they can in 30 seconds, okay? Now, if they can't do this, but they can do it this way, this is the first alternative. And then the second alternative is pushing up against the armrest, okay? They don't count, it doesn't count if they can't get up without having to push up on their legs, but you record the time and note the modifications. Yeah, okay. And then timed up and go. Chair's going to be up against the wall again. The narrative that you do is, we're going to test your walking speed, basically. And this is called dynamic balance. I'm going to say, and we have a narrative, and I can't remember it right now, but anyway, whenever I say stand up, I want you to stand up, walk past the tape or whatever, and turn around and come back and sit down. And it's ready, go, not ready, set, go. Why would it not be ready, set, go? Right, you kind of like, ready, set, it's like a race. This is not a race. You want to do their normal gait speed that they normally would walk. And so instead of saying ready, set, go, ready, go. And you start the timer, and when you say go, walk beside them, right, that distance all the way around and back until they sit down, and then stop. And it's really nice if you can have somebody timing and somebody else guarding them and recording. So that's very helpful to do that. You do 3 scores on that. They don't have one for the practice, but the evidence is that they practice, and you'll look and you'll see the practice score is always longer. The next 2 are going to be, and you average the 2 scores on that one. Okay. Timed up and go. Yeah, if they can't do it in 11 seconds, or if it takes them 12 seconds or greater, they're at risk for falls. And that would be a participant that we'd be looking to pick up with the Ortega exercise program. And you need to note, are they using an assisted device? And it's legitimate for them to use an assisted device. It doesn't matter, just record that they have it. And guard on the opposite side if it's a single limb thing. Then the other one, are they wearing appropriate footwear? Why does footwear matter? You think flip-flops might be good for seniors? No, okay. So, footwear can increase the risk for falls. Slide-ons can be very dangerous. And yet they love their slide-ons, because they can get in them and get out of them. But, how long do they want to be up and walking for the rest of their life? Anyway, so some of that can be important. And we may be able to help them. The other question is, do you have struggle with being able to pay for your appropriate shoes? And we're looking at possibly trying to get some contributions of shoes. We have given away in Champ close to 6,000 pairs of shoes at Marion and Caldwell. They're gone now, but they were given to us from Foot Solutions in Atlanta. Okay, at this point, you're going to be determining whether they would be an appropriate candidate, and we'll look at the sheet. If they're returning, and the first time, you want to know, have they fallen within the last month since they were last here, and have they been filling out their exercise sheets? And we'll go through that a little bit, yes or no. Were they injured is the other thing if they fail. You record that. If you have participated with any of the participants, you need to sign their individual assessment summary. So let's say that you did the stopwatch, but you were working, you need to sign it, okay? And if you want to use, I would put UNCA student to identify who you are as a credential, something. And then typically the PT or a PT student will do the summary, but you may have feedback into it to let them know that this was not normal. If you did some element, then you may need to note that. If exercises were given or if they modified their exercises, we typically record that. Okay, I don't know why that's okay. And then we got return visits, and so you'll see up here, oh, that was visit 6 and 7. You've got, wait a minute. Whoa, okay. Yeah, visit 1, 2, 3, 4, 5. And we're going to be here from March through November, so they could be coming back multiple months if they're still at risk for falls. Okay. Okay, let's see. This is, computers are not my friend. Here we go. This is the decision-making tree. And let's see. I don't know if I can bring it. Well, so if it takes them 12 seconds or greater to do the timed up and go, if they can't stand on a single leg for at least 6.5 seconds, if they've had a fall within the last year, or if they answered yes to question 9 on the information sheet, their ABC score is high, they're afraid of falling, then that would be a reason that we would consider physical therapy for them. And then the question would be, do they need it more often than once a month? And the PT is probably going to make that decision. So if they need it more than once a month, we are probably going to refer them out to some other physical therapy. But if they're safe enough, and we feel like they're safe enough to do the exercises in their home, or either with somebody there who came with them, or they could do it and wouldn't be at risk for falls, then we would issue the Ortega exercises. Typically 3 exercises are all that are ever issued in at one time. The research is quite clear. If you want them to be successful exercises, give them only 3 and modify it the next month, increase it the next month, but first 3. And so refer, if that's the individual exercise program, yeah, Ortega. We give them a calendar. If we issue them exercises, we give them a calendar. And on the calendar, I think maybe some of you guys have seen the calendar. It's dated, like March. Today's the March 4th, is that right? And so they would write, yes, they did their exercises, and did they fall? No. And so we give them a calendar for the next month and ask them to fill that out. And let's see, I was trying to think. Oh, ankle weights. We have adequate ankle weights for everybody. I will not give ankle weights on the first visit. I want to know that they're going to come back. But if they come back the second time, I will give them ankle weights, even if they don't need them. And I will begin the exercises just with the ankle the cuffs on without any weights in them, so that they can begin to learn how to put on the weight cuffs and how to take them off. Now, it's an individual decision, but that would be something that you might do. And then you guys will be doing follow-up telephone calls. Oh. Are you asleep yet? Death by PowerPoint. Oh, no. Okay, these are the forms that we talked about, the consent form. Most important thing on this one right here, primary care provider need their doctor's name, and they have to sign it. And you as a witness, if you're helping them fill it out, they print their name, sign their name, date it, and you need to sign it also as the person who witnessed that. Photo ID, photo consent, they don't have to consent. Note that they did not consent if they choose not to, and that's fine, okay? But it's there and available if they're willing to consent to the photo. This is the information form. I'm not going to go through the whole thing. This is one real important to get your date of birth on that one. And this is the health information form as well. So you're looking at heart attack, blood pressure, chest pain, all these things, you know, you may need to go through with them. Live alone, live with assistance, without, you know, all that. Number 19 is the question that you have to really, do you limit your activities because you're afraid you might fall, yes or no? And that would be one that we would pick them up because of. And then, let's see. Okay, then the medication list, this is going to be maybe a little bit different, but the date, the name of the medication, the dosage, and when they take it is what you should be recording on. And they should be either bringing their medication in the bottles or a list. And if they don't have it, we can't do it. But go ahead and put their name on the, I think it's at the top of the form. It's at the bottom. They don't have it. Daggum. Okay. Well, it should get the participant number on this. Is it? Oh, it's right above it. Okay, yeah. Name, date, and now if they come back for a second return and they've had a medication modification, document it in their medication. We will be sending that back to a fax to their doctor or primary care. That's a modification that we need to let the doctor know.
Martha, what does date and initials in the first column mean?
That's the person who is administering it.
Okay, so the physician's.
No, it would be like if it's a pharmacist, that would be the date and the initial of who's filling this out.
Oh, so like if I was, or if one of the students was, it would be like today's date and then.
And you'd be co-signing on one of the forms, so we would know. Yeah, thank you. And then any recommendations, and that's more for the pharmacist, again, above my pay grade. And if the pharmacist, and we're hoping that they'll be able to come in for an hour or two at the end and review all of these. And you're drawing a line between interactions, and if there's any high risk, then you hashtag it, asterisk, to note that. Okay, test and measures. This is the ABC, and you can read this, but again, this is one that and we can play with it, and I hope we will get to. You need to tell them that you need a number. I'm going to ask you these questions. It's about your confidence on being able to do different activities. I need a score between 0 and 100, and it needs to be on a scale of 10. So either 10 or 20% or 30%, how confident you are that you would still be able to remain standing. So the question comes, how confident are you that you would not lose your balance or become unsteady when you walk around the house? And they go, oh, I'm real high on that one. That's good. I can do it. 95. And you go, well, I need somewhere between 90 and 100. Or 0 and 100, and it can only be 10. So what number would that be? Don't tell them, don't say, is that a 90 or a 100? See if they can tell you which it was going to be. Does that make sense? So don't mislead them. And they can get tricky. There is one at the bottom that I wouldn't answer it. Walking outside on the icy sidewalks. Now, you guys probably need to deal with that here in Asheville more so than we do in Marion, but you can modify the score if. Anyway, you can read about that. But so what you do every time, how confident are you that you will not lose your balance or become unsteady when you're walking up and down stairs? And wait. And then they don't say anything. I need a percentage somewhere between 0 and 100 in a 10% scale, and see if they can answer you. Okay. The one that's tricky, several of the other escalators, not holding on, going up and down the escalator. But these are all. And then what you do is you average your percentage, and you get their average score on that one. And I think cut score is, 67? We have to go back and look at the form. Mini mental, again, we're going to be doing, let me see. Yeah, okay. What year is it? What season is it? And that can be tricky, because we're going to be here the 20th. Isn't spring start the 21st? Well, so the season can be a little bit tricky, but we were going to, but I think it's still going to be, we're still going to be in winter, because I think it's the 21st is spring. Anyway, and then what is today's date? What day is it? Is today Wednesday? Okay. And then what month? Is this February? Oh, no, it's March. See if they know those dates. What state are you in? What county? What city? What facility are you in? And it says hospital. You would say, you're wanting them to say the senior center. If they say the senior center, it doesn't have to be Grove Senior Opportunity. What floor are you on? They only have one floor. It's the first floor, so they'll probably get that one right. That's a grace. Then you're going to say, I'm going to tell you 3 items, and I want you to remember them. And I'm going to have you say them after I say it. And those items are bed, apple, shoe. Now repeat it. Bed, apple, shoe, and you listen for, okay, and you scored that according to that they were able to repeat it. And you can give up to 6 trials on that one. And then you can ask them to either spell world backwards or count from 100 in increments of 7 backwards. And so see if they can do that. And they need to go to 65 on the counting backwards. And so it's one or the other. They don't have to do, let them do whichever one they want. If they can't do it, don't frustrate them. Just say, okay, well, we'll just move on. Okay, now can you remember those 3 items that I told you? All right, good. So you get the 3 points on that. And it's 1 point for each one that they remember. You hold up, what is this? Marker. Yeah, typically you'd hold up an ink pen or pencil. You're looking for ink pen or pencil, that they would be able to identify the object. Okay. And I want you to repeat this sentence. And the sentence is, no ifs, ands, or buts. And so let them repeat the sentence. If they can, they get the point. Take this sheet of paper in your hand, in your right hand, fold it in half, and put it on the floor. You're seeing if they can follow commands, okay? And then you hand them, you hold up a sheet of paper, and we've already got these, they're plastic. Anyway, it says close your eyes, and you say follow the instructions on the sheet, and you see if they can if they close their eyes or not. The next one, I think they read it out loud. First they read it, and if they can read it, and then they do what it says. And then the next one is you want them to draw pentagons that overlap, and you show them an example and give them a sheet of paper and let them draw that and see if they can do that. So you're mainly there looking that they have the number of sides that they're supposed to, and that they overlap with at least 2 angles inside, I think is the way it works. So that's the cognition. Again, you total the numbers, and depending on the score, you record that. And that's the drawing. Depression, we do the short one, which is this one. You can't hand it to them to read, because this one it would be confounded. It's one that needs to be read out loud to them. So you're going to ask them, basically, are you satisfied? I want you to answer yes or no to all the rest of these questions. And you go, are you basically satisfied with your life? Yes or no. And then we'd mark it. And you work through all of them. And then you count the number in the A. Because it already has the instructions, you can't give it to them. It would mess it up. So you count the number of answers that they've answered yes to in the A, and it's indicative of depression. I think that's right. Yeah. Wait a minute. Count the numbers circled in the A, and that's the ones that, yeah, follow the instructions. Okay. So that's the depression scale. RAPA. Now this one, okay, I'm just going to tell you how to cheat on this one because it makes me crazy. You cannot go through it and ask each individual question because it's not going to work out that way. So what you got to do is, do you exercise? And they go, yes or no. How often do you exercise? And they're going to tell you, I walk every day. How long do you walk? And are you doing strenuous walking? Is what you need to find out from them. You know, and so let's say they walk every day. They're doing at least 40 minutes every 5 to 6 days a week. They take one day off. And so, but it's not vigorous. It's moderate. You can ask them, is it considered, would you count it vigorous or moderate walking? So at that point, then they were going to score 6. Let's say that they do, and it's a different person, and they go and they use the Airdyne, a stationary cycling with upper body ergometers, and they're doing 30 minutes and they're getting 9 miles in 30 minutes. That's vigorous, okay? And they're doing it 30, so they're going to get the 7. So you need to find out what kind of activities or exercise they're doing on a routine basis. Now, often it may be up in these numbers, but it could be, and those are the physical activities numbers, the first one. The next one, number 1 is, do you do any strengthening? And that would be weightlifting, anything where they would be doing resistance on the floor with using their body as a weight or something like that. So yes or no. And if they do it, let's see, once a week, calisthenics, weightlifting, okay. If they do it once a week, then that's a yes. If not, it's a no. Do they do any flexibility? That would be yoga, any stretching at all. And again, that would be once or more a week. And that would be yes or no. So going back to that, your summary sheet, let's see if I can do that. E. Yeah, it's probably easier to do it otherwise. Here we go. Almost there. Okay, RAPA. Okay, so these are the things that you would be scoring them in. RAPA. It's on the next page. Yeah. Yeah, okay, at the top, right here. Score 1, 6 or 7, or less. And if they do both flexibility and strength, then they get 2. If they do 1, they get 1. If they don't do either one, they get a 0. Does that make sense? If you have questions about that one, you can let me know. I'll be there. Okay, let's see what else we need to get through right quick. We're going to let you practice some of these. Okay, so I think what we want to do is to make sure that we're good to go on knowing what we need to practice. And so I'm going to refresh your memory again. What we often do on the 4-stage balance test, we'll often have a chair like this. So if they don't have a walker or something like this, they'll be sitting in the chair, and we'll let them stand up and get their feet so that and then once they let go, we start the timer. Okay, and again, they may hold on again to get the semi-tandem position. Once they let go, you start the timer. Then let them hold on again. Once they get into the full tandem and they can let go, start the timer. And then it's their choice of whether right or left foot. Once they let go, we start the timer. But if they're touching the chair, we can't count it. So you have to watch that and make sure that they're not touching it. But that's just an easy practice. Or on that one. And that's that 4-stage balance test. And we're going to let you practice that one, but not yet. Let me keep moving through. The dynamometer, and I'll pass this around. This is a grip dynamometer. There's all kinds of different dynamometers. They basically measure strength. And this one it's either, it's not going to tell me, kilograms or pounds of pressure, or pounds of force. We typically take the pounds of force, which are on the inside. You have to roll it back to 0 every time you do it. Then when they hold it here, squeeze as hard as they can. It should record. Yes, this is recording. Sometimes they don't work. So I got 80 pounds of pressure, and then you roll it back. That would be the first one. They squeeze again. You go hard, 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 push, 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 and then relax. 75. And then again, this is making me mad. I used to do 120. Okay, and squeeze as hard as you can. Okay, yes. I got 81. Daggum, I'm a weenie.
And as a practitioner, whatever you do, a lot of times when you are trying to measure someone's lung capacity or this, you get excited and you really try to egg them on, because people, they'll do a little bit, but you want to see what their max is, and they really need you to be a cheerleader for that to happen. So don't be shy.
Exactly.
It's just going to help.
Exactly. And then left, dominant, there's typically 10% difference between dominant and non-dominant hand. Again, and OTs you'll learn this, but you're going to learn how to do a whole lot more than just this grip strength. At 60. Oh no, that ain't good. Anyway, so you do 3 on either side, record all 3, and then average the 3. I'll just pass this around. You might find it interesting just to see how it does work. But the arms should be by the side squeezing, and but don't let them hold their breath. They start to hold their breath, say, blow out, blow out, Okay. 30 seconds. I think we probably, it's good to have somebody else timing and somebody guarding, standing by them. I would normally move this chair back into the regular position and start them out again. And they need to come out to the edge of the chair so that they can come to standing. And when you say ready, go, then they start. And I have them count out loud. Why would I want them to do that? I don't want them holding their breath. And a lot of times when they're doing stuff like this, they hold their breath, and that's not good. That's going to cause major problems. So and whenever they come to and sit back 1, and I'll make them, okay, count out loud 2, and I'm going to let them know when they get to 15. That's halfway through. And then when they get to 25, they got 5 more seconds, and then 30. And then if they're halfway through the stand, you count it. If they've not come all the way to standing, then you can't count it when the time goes up. So it's really nice to have 2 people working together, one recording, one who's facilitating on that. Let's see. Oh, sorry. Computers, they don't like me. Timed up and go. Again, tape would be out here. And then the narrative is this narrative. And what we're going to probably do is we're going to have it printed on the wall behind them on a laminated sheet so you can read it. So that we'll all be consistent. And it says, when I say go, I want you to stand up from your chair, walk past the mark on the floor, turn around, walk back to your chair, and sit down. I will be timing you using the stopwatch. And then, if they have any questions, answer those. And then ready, go. And then when their gluteus maximus hits the chair, that's when you stop the watch, okay? Buttocks. Oh, that's what it's called. You do a one practice run. The one practice is not recorded. I do record it a lot of times above if you can put it in. And you're going to see that the time typically improves. It drops down. It gets less. But you record the last 2 out of 3 that you do. Okay, and this is an important one. You understand, if the participant is one that I say we pick them up. In other words, they will be returning the next month because they are an appropriate candidate for CHAMP. We will give them Otega exercises, okay? This is the list of the Otega exercise list and you guys, you got a copy of the manual, the Otega manual with the class. And they're real basic exercises. Some of them we don't use. These top couple, rarely ever do we use those. They're exceptions. but knee extension, because we're trying to get lower extremity strength in the quads. Hip abduction, and that's the standing hip abduction. Toe raises, heel raises. We'd be doing some of those. Walking backwards. Why does walking backwards matter? Does anybody know?
Does it use a different set of muscles?
Well, it does, yeah, but there's a skill that we often do that we walk backwards to do. Can you think of it? Turn around to sit down. And you wouldn't think about it. We go to a skilled nursing facility, and they're often ready to sit down when they get here, and yet the chair's there, and they got to walk backwards to get to it. And it's one that, you don't think a whole lot about, but, anyway. So walking backwards can be a really critical skill, but again, the PT will probably be the person who's going to identify that that's one that they may need to. Probably having the PT select the exercise. What do you do? Do you guys know anything about different types of balance? If I said there's static and dynamic balance, what would you say static would be of those assessments that we did?
Sit to stand.
Well, actually, that's going to be lower extremity strength than power, okay? Do you know the difference between power and strength? Okay. Well, strength is just strength, how strong are you? Power, it puts an element of time to it. How quickly, with how much strength can you do that? And that's power. Why would power matter in falling or preventing falls? If you stump your toe, you got to do something really quickly. You got to have the power to get that correction, So power becomes a really important element a lot of times, and we don't often think about that. But anyway, so strength is very important. If we don't have the strength, we're in trouble. But then when we add power to it. And really sit to stand is more of a power because it's time and strength of the lower extremities. 4-stage balance is really your static balance. I'm standing here, can I do this? You'll find people who have diabetes and they have peripheral neuropathies, they can't even do this. So you don't have to move to the next one because they can't do that. They're not going to be able to do this. So, and it's almost diagnostic for peripheral neuropathies. What else? Can you think of another reason that you might have a peripheral neuropathy besides diabetes? Do you know what I'm talking about? Where you don't know where your feet are in space? You have the blood circulation is not getting there, so the nerves die, and as a result, you don't know where your feet are in space. Well, cancer patients, they've gone through chemo. You'll see this patient typically, a lot of times, they have real problems with that. So anyway, those are some of the situations. Dynamic balance, timed up and go, is a classic dynamic balance. They got to stand up, walk all the way to the other side, turn around, come back and sit down. Dynamic balance. And a lot of times they can do that, but they can't do the 4-stage if they have a peripheral neuropathy. So it's really interesting, and it helps you make decisions. What exercise is the appropriate exercise for you to use with the patient that you're working with? And that's why the PT is probably going to help you make that decision. What are the 3 most important exercises? Can I give this? And it's going to be based on the ones that they couldn't do, but you feel like they could be safe if they went home to try to do it by themselves. And we put it in a controlled setting. So they're going to be doing maybe a single leg stance holding on. And you're going to talk about how you hold your posture normal, try to go into normal posture, and then just try to gently. Anyway, so those are some of the things you're going to see with that single leg stance. Upper extremity support, no upper extremity support, trying to increase that. So those are going to be things that you make, decisions you make with that. This one is a great tool, but we don't use it. And I hate to say that, and it's help you, if you really want to understand more about the patients, you may want to go through this, and it can help you make decisions. We often do some of these things, but it's not required to fill out, and so it doesn't get, and with all the other things that we have to fill out in CHAMP, we typically don't have the time to do this one. And I hate to admit that, but it's got some good things on it. So looking at it, you may want to look at it before you come today that you're going to be working at CHAMP. This is a new form. Anytime that you can help, let's say you start with a participant and you can get their number on all the forms that are in that file, we will love you when you get them back to the exercise and we're trying to make decisions and don't have to fill out the rest. This is going to their primary care, and it's an introduction. We've never been in Buncombe County. The primary cares are going to start getting this information. They go, what is this? They have to keep it because it's got its medical records. Anyway, this is kind of an introduction. What is CHAMP? And so based on their client that they're seeing, their patient that they're seeing, so their name and date of birth, and that's typically personal private information that they have to keep. This is the summary sheet, and it's the one that's faxed again back to the doctor, and it's telling them, you know, when we looked at the assessment, their timed up and go, was it 12 seconds or greater? Were they not able to stand in a tandem stance? Did they report having a fall within the last year? Are they taking medicines that are high risk, or do they have interactions? Do they have orthostatic hypotension? So this is a summary sheet that's going to go back to the, and if you find some of these and you can identify them, you can go ahead and mark them. The patient's name goes there, the doctor's name, fax number goes there, date, patient's name, date of birth. Depression, was their geriatric depression scale positive? Was their ABC scale, was it out of the norm? Cognitive impairment, the mini mental. Anything else that we might identify? Let's say that they report that they have foot pain and they haven't seen a doctor. We maybe should let the doctor know it's limiting their activities. If the client was not at risk, we're going to send it back to the doctor and say, we'll see you in a year. Keep doing whatever you're doing because it's working. Maybe make other recommendations, a walking program. Living healthy with chronic pain, that's a class that they have here through the Land of the Sky. Tai Chi for prevention, again, here in the community. Balance and strengthening exercises, that would be if we issue them. A matter of balance class, the fear of falling, healthy ideas. A CHAMP follow-up. If they're coming back the next month, that needs to be checked and what month they're coming back. Do they use an assistive device? Do they need speech-language pathology? Do they need any other? Do they need a home assessment? Land of the Sky can provide some of those things for them. Any other recommendations? And then the physical therapist, nurse, or the pharmacist would typically sign those to send them back to the doctor or other PA, whatever has. This would be other referrals. We sometimes use that.
I just have a quick question.
Okay.
Because we're going to be making sure that the participant ID is on all the other forms. Do the students need to make sure participant ID is on here or no?
No, I don't think so, because the doc's not going to know it, and the main thing they're going to probably identify is the date of birth. That's probably the most, important one that they have, the client and client's name and date of birth. Good question, yeah. Let's see, what else? This is stuff for first-time volunteer checklist, and I don't know what's going to be required for you guys. Sometimes some students are required to have some of these filled out by somebody who was supervising them, and you can look at it. This would give you a baseline of what you need to know in preparation to be there the first day, and skills, that you know the policies and procedures. And if you were coming without having training, but your faculty trained you, they would do this. This is the sign-in sheet that we will have available. I think it's going to be done electronic.
Yeah, do you want me to pull it up just?
Yeah, uh-huh.
And so I'm going to reach out. So my students have already
Does she need this?
done that. You just stand close to me.
Okay.
All right. So, just a second. I'm going to open this, but it's got some client names on it. So y'all could you not show the screen for a moment? Thank you.
We're using Google Docs? No.
Okay, you can show the screen. So yeah, so this is a Google Sheets, and we have set this up for Buncombe County and for Macon County. And so for like May 15th, we're going to have 5 new participants, and we are going to have a lot more returning participants. So I will go in this more detailed with the UNCA students, because one of the things that you're going to be doing is making calls to remind people that the appointment's coming, and then doing a follow-up call about 2 weeks after they've done the CHAMP visit and 2 weeks before they return, to see how the exercises are going, if they've had any falls and stuff. And so I will spend more time helping y'all understand how to use this, so we all have a standard, because Jeannie is going to follow up with this and oversee and just make sure everything's okay with our participants and not having any concerns. So, yeah, is there anything else that you would say about?
Yeah.
Okay.
We'll go through the narrative on the, you have a narrative that you will have for you that you can use when you call somebody, and we'll go through that shortly. Okay. Okay, there's another one, right? Yeah. Okay, so these are the scripts that you'll be using when you call the participant. And you'll just be reading, I'm not going to read through this, but you guys, I think you're going to do it in class. And so you'll have a practice with that and clarify any questions that you have. But that would be like 2 or 3 days before they come. You'll call them to confirm that they will be attending CHAMP. And then the next one would be a script. There would be a follow-up call to make sure that they're doing what they need to do and they have no, and we've cleaned this up so you'll go through this and practice this. I'm not going, okay. And then this is the form that we talked about. Everybody who participates in CHAMP as a volunteer or student will need to sign this saying that you will not share any confidential information with anyone. And there again, that needs to be such, your signature, we may not, I almost wish we would do a printed and signature because you can't read them a lot of times. I think I've already talked about, this is a self-assessment. And you may want to look at this before you come to see what would be high expectations let's say in interpersonal skills and communication, or problem solving, or responsibility and participation, or professionalism. So that was a tool that we developed. I used it with my students. I taught PTA students at Caldwell. We brought them and they used that. They had to fill it out. And so it's a self-assessment. And then right now I don't know the need for the survey unless you guys decide that that would be. Sometimes we've had participants surveyed. Footwear, we're currently not doing that. But if you identify somebody has an issue with footwear, cannot afford it, please bring it to our attention. I think there might be some ways to access footwear for them, appropriate footwear. Yeah. Any questions? That's a whole lot. I mean, we'll probably cut off here and then do a few practices with the motor things just so that you can practice those to see and maybe some of the assessment skills and let you try those. And that way you'll be more confident when you go then on the 20th. No questions? You guys are, I'm good then. Okay. So we're going to let her lay here for 5 minutes. Okay, so it's been 2. You doing okay? Okay, so it's been 4 minutes. And
Leah, I would like you to be quiet because this is how we can measure you appropriately. So just quietly sit there and we can talk after, okay? Because people are going to want to talk. They get bored, they get uncomfortable, they start filling the silence. So maybe you can walk away and say, I won't be like that. I'm just going to be over there. My name's Amanda. If you need me, just call out and I'll be paying attention. I'm just going to give you a little more quiet time and we have 2 more minutes. Okay.
do you fully off? Can turn that off? Turn the.
Yeah. And what we'll do, and I'll touch base with them about this afterwards, but after spring break, I'm realizing that it would be good for us to practice a lot of this stuff again and maybe have a little more time to understand the mini mental exam and things like that. But also from my experience in training, oh yeah, I forgot about that. From my experience in training, practicing scenarios is really important because you know what you're supposed to do, but if you don't know how to say it and without offending someone, or like I was trying to just model there, is like, oh, I'd love to talk, but for us to get accurate measurements for your blood pressure, I need you to be kind of quiet, and I'm going to go take care of something right over there, but my name's Amanda, so let me just call out if you need anything. I'll be paying attention. But that way you've moved away from somebody, and now they won't talk to you because it's just really hard, so.
Just the truth.
Where should this be so that we can hear? I mean, if it's, you're going to lead this, so you should take it.
Okay, yeah.
I'm recording you from over here with this, so
Okay.
that should be okay.
Okay.
I just want to take it.
Okay. All right. Do we want to assume it's been 5 minutes now?
It's been 5 minutes.
Okay. So we're going to get a blood pressure, and my pulse oximeters, none of them are working. I don't know if you have one.
I don't think I have.
Okay, but we would go ahead and put a pulse oximeter on her finger, okay? And we'll let you go ahead and get a blood pressure.
Yeah, is it, it's a thin sleeve, so are you?
She can go through it probably. Yeah, you should be able to do that. Go ahead.
So, hi Leah, my name is Albert, and I'll be taking your blood pressure today. Just go around your arm. And if you can lift your arm, thank you. I'm gonna check for, and you can set your arm down now. Thank you.
And I'm Amanda, I'm gonna be Albert's assistant, so that makes it a little easier because everyone gets nervous when you have to perform in front of a class. That's good, you don't have to worry about that.
So I'll go ahead and start now.
And before any of y'all are expected to take a blood pressure, we would make sure that you have learned how appropriately. Now, both Albert and Aaliyah have done EMT basic training, so they have been trained, but they don't practice it a lot. Which makes it,
I've done that before
which
too.
makes it really hard and easy to miss steps. So, so he would take her blood pressure, and he would write it down immediately, because it's easy to forget. So we'll make sure that we have this space set up. And then,
Actually, what's ideal is if you have somebody else who's recording, you tell me, announce to me, I'm recording. So what did you get for the blood pressure?
115/60.
Okay, so we record that, and then the heart rate wasn't, you had the pulse oximeter, and it was 72, right?
72.
Okay, so we record that. Okay, so the next step we're going to do right now is go ahead and let her stand up and keep the blood pressure cuff on and keep the pulse oximeter on and let her come to a stand. So be careful, roll over and stand over that way, please, ma'am.
let us know if you feel dizzy or lightheaded at all.
Yeah,
How do you feel?
okay. So go ahead and get her blood pressure right away once she's standing.
Just keep it next to you, really.
So, Albert, can you take your blood pressure?
All right. I'll be taking your blood pressure again. Okay.
So what did you get when we record?
120/72.
Okay. Okay, and record it. And so we started timing her again because she's going to be standing for 3 minutes, and you can monitor, is she sweating? Has she turned gray? Is she dizzy, having any issues with any of those things? And is that, okay, so she's fine. So she keeps it. Now you're going to have to, you should be leaning on here. Okay, so standing up, unsupported. Yeah, and you can talk about football games now. No, I'm just.
So now you can talk?
No, you're not really supposed to. It's supposed to be, again, accurate is going to be relaxed, non-focused. Yeah.
So that again might be a time, because it gets awkward, is you might say, well, while you're standing here, I'm just gonna fill out some paperwork and do something and just sit here quietly with you, and I'll just update you on the time as we go.
Mhm.
Or again, you could say, again, my name is, you show them your name tag, my name is Amanda, and I'm gonna be right over here if you need anything, and I just want you to just stand there quietly and relax until the 3 minutes is up.
Mhm. So it's been 3 minutes. So you're going to go ahead and get another blood pressure.
All right. I'll get another blood pressure.
Okay, and then what did you get? And we'll record it.
115 over 65.
Okay.
Okay, and then the pulse?
Yeah, heart rate.
Yeah.
And she's still got the pulse oximeter on her finger, and you can just look at that and record that. Okay? Mm-hmm.
Will the pulse oximeter be on the opposite end?
It probably would be, yeah. It should be.
Yeah, so,
Yeah.
and I think doing this in pairs will be really good so that we can kind of practice in pairs in 2 weeks after spring break, and then, so we'll just kind of have a standard.
And one of the things that I was going to share with you guys is that typically when it's your first champ, you want to see one of the leaders or one of the healthcare professionals who've already been to champ and worked in champ, and you be the assistant the first time and go through as much as you can on that first time. And then the next one we'll let you start being the lead person. But your first time through, if you can be the assistant, that's going to probably help more, and you'll learn a whole lot during that process. Yeah. Okay. Good. Do you want to, yeah, I was trying, orthostatic hypotension, I was trying to think what else. Do we need to do it in video on anything else? Do we want to do a timed up and go?
Let's show one timed up and go.
Okay, I'm going to use
With
this.
guarding. So I
Yes,
think
yes,
you should
I'll
the
do
guarding.
that, sure, yeah. I'm going to,
Thank y'all for your help.
okay, so, does somebody want to be a subject
Actually,
participant?
I'll be the
Okay.
subject. Let me do-
Okay,
or someone
1,
be the- so I
2,
want you to
3,
be the guarder.
5, 6, 7, 8, 9, 10, okay. This would be blue tape here, and so.
This is supposed to be a chair with arms, right?
Mm-hmm, yep. And I hate these, but let me make sure. Okay. Okay. Now, and I need to read the script, but I don't have it in front of me. But what we're going to do is I'm going to have you stand up, walk
I want
past.
to get the script so we do it officially since it's being
Sure.
recorded here. I got it.
Oh, you got it printed out.
Well, I'm happy we've got it printed out.
I don't know that I do. Let's see, PowerPoint. Okay. All right, Amanda, when we're going to do the timed up and go, and when I say go, you're going to stand up from the chair, walk past the yellow tape, turn around, walk back to the chair, sit down. And I will be timing you during this time. And the script will be right back here. And then, okay. Ready, go. Okay, so that was 10 seconds and 80. That's the distance I'll walk with them. And I will do that always, because the last thing I want to see. And I don't mind them in my lap. I may ask you to pull the chair over so I can put them into the chair, and I've done that before, but I don't want them in the floor,
And so I think it's, sometimes people have personal space issues, and so telling them that you're going to do that, because if you get that close, they might be
Yes,
like,
exactly, and I agree.
And so just
Yes.
saying, I'm going to be right, I'm going to be close to you, and I might put my hand near you. I won't touch you unless I feel as if you're falling.
Yeah, that's not a bad instruction, exactly. Yeah, because you're right. If that close, they may not understand why I'm so close, but you can't catch them unless you're there. Questions about that?
And
Okay.
you also want to read the script specifically, because we're doing this is an evidence-based prevention, and so that's why you don't say ready, set, go. That's why you don't explain the directions to them again unless you just start over, because we're trying to create this standardized thing, because it gives a lot of good information when you follow the standardized outline.
Right, exactly. Is there anything else that we need to video?
Also, so that y'all have an idea of the big picture, because this is interprofessional, understanding that, wow, physical therapist has all this insight into balance, and I'm a physical I'm a nurse practitioner or even a dentist, and I notice my patients having trouble like getting from the waiting room into the chair, and so maybe I should consider how how else I could help make sure that this person is preventing a bad outcome in their life.
Mhm.
So that's the goal in being able to show y'all all of it. You have the first 2020 screening is in McDowell County.
Right, on the 13th, Friday the 13th.
Friday the, yay. So, and I'm actually thinking that I should probably come up there just so that I am completely in the know.
Okay,
on how it
we'd
all
love to
should
have you.
go. So I'm just gonna, I'll follow up with all of y'all, but I extend the offer if any of y'all are interested.
Is it right? Currently, we have, I think, 4 participants signed up for the morning. I don't know that we have the afternoon fill, so it might only be a half day.
Okay.
And you can learn quite a bit in a half day. And I've gotten several volunteers. We've got 2 therapists, and a retired PT, and I think a nurse. Anyway, we've got a couple, but we could use more help.
Yeah, and the benefit to, like, Buncombe County is convenient, but there's gonna be a lot of students there. So actually, if you are able to make it to some of the McDowell events, you will actually get more experience. And as a student, as a future health provider, that's one nice thing about going out of your way to help in a location
Thank
like
you.
that. So, yeah.
And you get lunch free. Oh.
And you get lunch for free. So if any of y'all are interested in that, I will send you an email.
Thank you.
Figure that out.